I'm Shannon Weber with HIVE, a hub of positive sexual and reproductive health, and I'm here in Miami. It's June 28th, 2015.
And I'm Jonelle Potter, and I'm here at the University of Miami Miller School of Medicine, Department of Obstetrics and Gynecology.
And it's been amazing to talk with you today about your program. And in part, I want to start the series of videos we're going to make with you by talking about the early days of the epidemic. And we've been talking about how the story of women are really left out of kind of these history books or the covering what happened with the HIV epidemic. And you really were there at the beginning.
I was here in Miami at the beginning where we had a large population of women. But I think what's important to start this story is to think about where we are today and how we met.
Mm-hmm.
We met at meetings where we're talking about eliminating pediatric AIDS and eliminating perinatal transmission of HIV. And every time that I hear this topic, it brings me back to those early days.
Mm-hmm.
And those pioneer physicians that I had the wonderful opportunity to work with, as well as the women volunteers. And basically the story goes as this. We knew we had a terrible disease, and we knew that we had just gotten HIV testing, and Margaret Fischel was one of the pioneers here in Miami who was the PI on the study that discovered that AZT was working in preventing death in her population of adults. And we had some of those adults on AZT, and some of those women got pregnant.
Mm-hmm.
And we didn't necessarily want to take them off the AZT. And in those early days, it was really bad because the women were very sick, or eventually got very sick. And a lot of them had very low T cells and a lot of opportunistic infections. And the women, particularly PCP and toxoplasmosis, what I remember. So we also had Mary Jo O'Sullivan, who was the obstetrician, who looked at all of the data, who worked with, at that time, the Pediatric AIDS Clinical Trials Group and Gwen Scott, and together with collaborators from around the country, wrote a phase 1 clinical trial to really study the pharmacokinetics of AZT during pregnancy.
Mm-hmm.
And so I had the opportunity to consent these women. So these were women that were in the clinic, they were positive, we didn't have much for them. We did what we could, supportive care. It was a time of terrible stigma. Everyone was afraid.
Mm-hmm.
Everyone was afraid of transmission. Patients were ostracized. If they went into labor, if they were known positives, they had trouble even with EMS getting to the hospital. People dressed up like they were Martians to protect themselves from these patients. So it was really a terrible time for these women. And all of a sudden we had an IRB-approved phase 1 study to look at pharmacokinetics. It was called 082, ACTG 082, and we had to enroll pregnant women to let us study, do 12-hour PKs in them to look at AZT during pregnancy and throughout their pregnancy and labor and delivery. And I would look into their eyes and ask them to participate in this trial, which, as much suffering as they were going through, to volunteer to get stuck and be in the hospital bed and provide samples of their blood, and they volunteered.
Mm-hmm.
And because they volunteered, they knew, when I looked into their eyes, they knew it wasn't going to be for them.
Mm-hmm.
They knew it was going to be for the women that would come after them. They knew their fate. They knew they were going to die. Everyone around them at that time who had HIV and AIDS was dying.
Yeah.
So they knew it was coming. They were afraid for their babies that they were going to leave behind, but they volunteered, they consented. And here in Miami, we had the largest group of women who consented for 082, and because of them, because of their selfless desire to help the women that came behind them, we had preliminary data, pharmacokinetic data, that led to the protocol development, which is now known as the landmark study 076. And so 076 was the phase 2, phase 3 that followed.
Mm-hmm.
And as we all know, 076 changed the world.
Yeah.
Because
it's the basis for all of this.
We learned so much about the benefit of AZT prenatally, during the interpartum period, and neonatally, and we were able to reduce perinatal transmission with just that one drug to around 8%, and then with multiple antiretrovirals, today a baby born with HIV is a reportable case, and we examine it because it shouldn't happen. So in my lifetime and in my career, I saw this perinatal HIV infection emerge. We lost a lot of wonderful women, and we lost a lot of babies, and now we're really close. And we're really close because of those women that I remember fondly and dearly for being so brave and volunteering that led us to where we are today.
Thank you for sharing that. It's so beautiful.
It's a great story.
Yeah, thank you for your hard work in it too.
You're welcome.